My name is Hannah at ARC, and today we're going to be learning tips and exercises for speech therapy from Angeliki. If you missed out on Angeliki's speeding therapy webinar that we hosted back in April, I'll just do another quick introduction about her. She's from Athens, Greece. She's a speech therapist, myofunctional therapist, and SI therapist, and she graduated from City University London in 1996 and also trained by the Academy of Orofacial Myofunctional Therapy. We're also developing some really new, exciting products together. So stay tuned for those. We'll have more information about that later. But yeah, I'll just send it off to Angeliki to start her presentation.
So hello, Hannah. Hello, everyone. For those that they haven't met me in the previous webinar, I am Angeliki. I'm a speech and language pathologist working here in my clinic in Athens, Greece, and I specialize in apraxia, speech and language delay, and feeding therapy. I'm also a myofunctional therapist, and I have developed my own method on tongue thrust. So today in this webinar, we're going to talk about speech production and articulation and how we can facilitate this by using some of my favorite Z-Vibe tips. My personal therapeutic approach when I work on articulation is a combination of oral placement and myofunctional work. I believe that when we are targeting on a phoneme, working only on oral placement is not enough. If we want better and quicker results, we have also to work on muscular strengthening and stimulation and work with all the muscles that are involved in the production of this phoneme. So today we're going to split the exercises according to the placement of its phoneme, the oral placement, and I'm going to use some different Z-Vibe tips for each exercise. So we're going to start with bilabial phonemes, go to dental, alveolar, palate, and velar. All right. So at the beginning of our therapy plan, let's say we have a 3-year-old child coming to your clinic with speech and language delay. We usually start working with bilabial phonemes, p, b, m. They come first in the developmental chart, but it's not only that. For bilabial phonemes, we need good lip closure, and good lip closure is important not only for speech, but also for breathing. If we have a mouth breather, then we have loose lips and we have to establish good lip closure. It's important for feeding. Loose lips, they cannot hold the food inside the mouth, so we have drooling and cannot control the quantity of the food. And in general, for the facial appearance of the person. So we need to establish first good lip closure. In order to facilitate this, I'm going to start with my favorite Y tips. I'm going to use first the thicker one. So what I'm going to do is put the Y tip, of course with a vibration, on the lower lip. And just hold the lips together up to 10. Because I want to give the child this sense of how the lips touch each other. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I don't emphasize so much on the upper lip. I usually work on the lower lip because usually we have this appearance. So lower lip close to the upper lip. Then I'm going to repeat the same exercise with the medium one. Again, up to 10. Three times. And finally, I'm going to add the flat one, the thinner one. I leave it at the end. I have to tell you that those exercises, of course, I'm going to use the word child, but you can use them the same way with adults. So I'm going to take the thinner one. First, pushing the lips together. And then I'm going to ask the child to bite and hold up to 10. You can do that 3 times. And then I'm going to gently try to pull it out. You see, there is nice resistance, and the vibration gives very nice stimulation on the lips. Since I'm holding the white tip, I'm going also to use it if, let's say, for example, we are working on vowels like E and E, and we want the lips to spread just like that. Usually in Greek, I don't know, in other languages, we have some children that they mix up A as an E or E as an A. So if you want to produce the phoneme E, I'm going to E, 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 E. It's nice because with a white tip, you can E, 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 spread the lips apart. And you can also use it a bit more, take it off from the Z vibe and ask the child to hold it like this. After the white tips, I'm going to use my favorite button tips. I use the button tips a lot. You know that already from the previous webinar. It's my favorite tips. I will start with the bigger one because it's easier for lip rounding. So I ask child to close the teeth and then hold up to 10. And then I'm going to pull it gently out from the lips. How many times you're going to do it depends on the tolerance of the child. The more, the merrier, but you can see how much the child is working with you. Don't forget the sides of the lips. And we can also work it all the way around from the one side to the other. And I do also some very nice puff, puff. They like that one, especially if it's very loudly. Then I'm going to use the next, the smaller one. Unfortunately, I can't find today number 2 from this set. I think I threw it away by mistake. I'm so sorry. If you have it, you're going to go to the next blue one. So I'm going to go straight to the third. It's from this is the set with the 2 smaller button tips. They come in 2 sets, 2 big ones and 2 smaller ones. Then this is from the second set, the bigger one. Again, the same, pull and hold. Always at the sides. And finally, the smaller one. When you try it, you will see that it's much more difficult with the smaller one because you need to bring much more the lips together in order to hold it, instead of the bigger one, which is much more easier. You see, you just have to close a little bit the lips. So start with the bigger one and gradually go to the smaller one. What I like to do in this exercise, and I find it's very funny for the kids, is I'm going to use, I have 2 sets of the smaller ones. So I'm going to start with those 2, and I'm going to add 1 at this side. This is very funny, very good for the sides of the lips. And I say to the child, oh, it's wonderful. You look like an elephant. You can also try to pull it out. And let's see now if the child can hold 3 bottom tips. Yeah, it's very funny. Don't try it with the very big ones. It's more difficult. Perhaps with an adult, yes, you can do it, but it's nice to do at least 3. I haven't tried 4. I think 3 is enough all together in the mouth. And then I'm going to use, again, we're still on the bilabial phonemes, p, b, and mo. I'm going to use this flat texture spoon. It's from this is from the list of, from the feeding tools, but I use it as a spatula. So what I want the child to do is just close the teeth and then hold it with the lips. You can play beats, just, oh, I'm going to make it much more difficult. Be careful. Or you can add some Oreo or Cheerio on the top for some extra weight. I don't know if I'm going to succeed. It's not heavy, but we'll just say that to the child to be more creative. All right, so this is for the bilabial phonemes, wide tips, bottom tips, and the textured flat spoon, the handled one. That's how it's called in the list of the art therapeutic tools. And I like the texture because it gives extra stimulation on the lips. Let's go now to dental, labiodental sound phonemes like f, v. The only exercise that I can use here as an art therapeutic tool is by biting the spatula. And this is to add some extra strength on the biting and stimulation where we should bite. For the the phonemes, very common in Greek languages, I think also in other languages, we want good coordination of the tongue in and out of the mouth. So I'm going to take again the spatula and ask the child to get the tongue in and out. This is a very good exercise for apraxia also, because coordination is very important. Just to make my exercise more difficult and more fun, I'm going to add and then the child can eat the Cheerios. I like those Fruit Loops Cheerios mostly because they come in many different colors, and we can use we can do the same exercise but with different with every color. So we have many repetitions. Let's go now to some alveolar phonemes like t, d, n, l. Very important l. We have many times in the clinic children with gliding ya instead of la, and of course s, s. We have in many cases the lateral s, lateral s, and this is also difficult to work with. For a good alveolar phoneme, we need, of course, tongue elevation. For tongue elevation, I'm going first to start with a smooth Z-vibe spatula, tongue depressor. I'm going to add my vibration and gently pull the tongue upwards 3 times, 4 times, and then hold. So it's always pull and hold. because don't forget that the very weak tongue is going to stay down on the base of the mouth, and you have to elevate it with your Z vibe. The vibration gives so good stimulation. I can also use one of my button tips for tongue elevation. Look how nicely it goes under the tongue and elevates. And after I have worked a little bit with elevation with the help of Z-Vibe spatula tip, I'm going to start working now on the correct spot, because when we want to produce a phoneme like L and N, we need the tongue to touch the palate alveoli, those bumps behind the teeth. And in order to give this knowledge to the child, I'm going to use my favorite fine tip. This is a must tip for working with L and the spot placement. And I'm going to add again Cheerios. And what I'm going first to do is, with the vibration, introduce, put it on the correct spot, on the alveoli, and ask the child to lick the Cheerios. I stay there up to 10. If the tongue can't still elevate, go a step backwards and work again with helping the tongue with your spatula. When we are all right at this step, I mean the child can lick and reaches with the tongue the Cheerios, then I'm going to gently take off the Z-Vibe, but ask the child to stay there and hold the Cheerios. This is a very nice exercise. Look. And then can have the Cheerios. So first to the correct spot, tongue elevation. And then take it out. This is an exercise that I always give at home for carryover. And if the child cannot elevate on its own, I ask the parent or the child, if it's older enough, to put the Cheerios on the correct spot and then elevate the tongue and stay there. Otherwise, the child can put one Cheerio on the tip of the tongue and stay there up to 10 with many repetitions. This is a very important exercise also when you treat tongue thrust, the correct spot on the palate. Another idea, again, if you work with L, especially phoneme, is to use a lollipop. Always choose a small lollipop and put it on the Popette tip, because the vibration also gives very nice stimulation where the tongue should go. Since I'm holding now the Popette tip, I will show you also another exercise that you can use for lip rounding, especially if you work with phonemes like sh, sh. So close the teeth and not bite it, just hold it with the lips. It's very nice to work on this lip rounding. That was nice. It's a strawberry. Last, another exercise that I'm using in this for those alveolar phonemes. I'm going to take again my spatula. You can also work, if you don't have the spatula, with the spatula of the Z-Vibe. It works the same, but this is a bit longer, so it's easier. And what I'm going to ask the child is to coordinate the tongue and have upper and downwards. Look at this. Again, this is a very good exercise for apraxia because we need coordination. Very good for tongue elevation because you see how the tongue goes backwards and upwards. And if it's very difficult, the upward movement, what I'm doing is I'm helping the child like this. I mean, if you have a child with more severe with dysarthria, this is a very good exercise to give this sense of tongue elevation. Let's go now to some phone with the palate phonemes like R, very common in speech therapy in Greece, I believe in all the countries, and especially in Greek or Spanish, I think, and I don't know in other languages. We don't have this R, palate R, but we have a strong trill like R. So we need very strong tip of the tongue and also good tongue elevation. What I want to focus here is that for a nice R, we have also to work on the base of the tongue, but I'm going to present the exercise when we are doing the Velar phonemes. For the moment, we want to work on tongue elevation, not so much in front on the palate alveoli, but a bit backwards. As I'm saying to the children, it's like we're going to swallow our tongue, R. That's why I always start with the English R, even in Greece. And, you know, Greek parents say, oh, it's a bit English. Oh, don't worry, it will come forward, trust me. So I'm going to take, again, the bottom tip, because I like it to push the tongue. And I'm going to use this nice vibration. Ideally, don't use the bigger one from the blue set. Then the other one, the one I've lost, sorry. And I give this vibration to the tongue upwards and backwards. Then I will take again my fine tip, add a Cheerios, Fruit Loop. And remember when we were showing the L phoneme, we had the Cheerio in front on the bumps, on the spot. And now I'm going to put the Cheerio a little bit backwards, not touching the palate, in the middle of the mouth. This is exactly where we want the tongue to be in order to pronounce R. R, R, R. While I'm doing those exercises, usually I'm not asking for the production of the phoneme. I'm just focusing on working on the tongue. And for better coordination, you can work on both placements, in front, backwards. Because you're going to meet in your therapy children that they cannot pronounce either L nor R. So you have to always work on both of them. So in front, backwards. For a nice R. And finally, let's go to the Velar phonemes, like K, G, R in some languages. Usually children have the fronting problem. Instead of K, they say T. And what we want here is tongue retraction on the base of the mouth. So I'm going to take again my favorite button tip. That's why you need to have the button tip. It applies everywhere, in feeding therapy, in speech therapy, in all the phonemes. I'm so happy that they have created this new Z-Vibe tip. So what I'm going to do is to push the tongue backwards on the mouth. Be prepared to meet some strong resistance from the tongue. If the child cannot pronounce ka, then ask to say a. You see, with a nice a, I can go in and push. So I push, and then I hold. It's very nice just to give the idea. And at this moment, when I'm using the bottom tips, sometimes I introduce the phoneme like ka, 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 ka. And I can see how much resistance I have from the tongue. I want to share you at this moment an exercise that I'm using for the tongue retraction, and I have it in my tongue therapy in my tongue thrust therapy program. I call it bowl exercise because I want to create a nice space between the lower teeth, the tongue, and the mouth. So if the child can say ka, I ask to say ka and stay there. Or if we have a problem with ka on ga, just say ah. So I have the little space here, my little bowl, and I'm going to take, where is it? I'm going to take a Smarties. So first, tongue at the back of the mouth, ah. And I'm going to add the Smarties and stay there up to 10. And then the child can eat the Smarties. Gradually, why I put the Smarties is it works like a stop for the tongue, because instinctively when you first put it, it goes to, wants to lick it, and it's going to go away, and oh, what a pity, we cannot have the Smarties. Let's start with another one. And then you give extra motivation to the child to stay still, the tongue at the base of the mouth. And then can have it. Gradually, I add some bigger and bigger snacks. I don't know if you have them the stage. The bigger one I use is Maltesers. Look, it's quite big. Ka, ka, or ah. And I use this exercise also when I work with ka and ka, because I have the Smarties and ask the child to say, for example, a word like cake, K, K, ka. The secret in those exercises is that I have nice snacks. Of course, some parents don't like that very much because I use sweets, but for me, it's very important to have the child motivated and happy, and of course always ask for allergies before you introduce snacks to your therapy programs. But I think it's a very fun way to do more and more repetitions, and I always give to the parents some more healthier versions of snacks, like you can use a blueberry or a pistachio or a peanut if you don't want to use so much sweets. And I always have those little bags that I put inside some snacks that I'm sure they can have them in the house and do as a carryover this bowl exercise that they love very much. All right. So I think at this moment we have covered most of the basic phonemes in the oral cavity, and we can go back to Hannah and have some time for extra questions, from some questions. Thank you very much.
Thank you, Angeliki. That was absolutely wonderful. We'll go ahead and take some time for some questions. Let's see. And the first one we're going to do, why do you work on the size of the lips, the function of it?
All right, I think they mean the sides of the lips, yeah, because sometimes we may have good lip closure in the front, but here we have some drooling, or in some people there is an asymmetry in the face. You can also see that when you work with adults after aphasia or some an accident. They have this asymmetry and a weak place on the weak side on the face. So yes, it's very important to see that it's not only here, but the sides of the mouth.
Mm-hmm. Thank you. Thank you. That's nice. All right. And there was another question. How do you combine working on speech and language development together?
Okay, nice question. Usually when, as I said, if we have a very young child, 2.5, 3 years old with speech and language delay, this is the diagnosis with no other symptoms around the diagnosis, only speech and language. So I start with the bilabial phonemes, as we said at the beginning, and I combine those phonemes with some target words. So let's say that I'm starting with the word b, with the phoneme b, and also it's nice because b, mo, they have some everyday words for the child from those phonemes, like mommy, bath, bowl. So I start with phoneme b for articulation, and I have 5, 6 target words like bath, bowl, bob, some names. So that's how I combine articulation and language. And I do the same as long as I'm going developing more phonemes.
Yeah. All right. Let's see. Now we have Nicole. Let's see. All right. So with babies and kids that are hypersensitive with having their mouth touched, especially to fit with the Y-tip, what are some prep activities that you would suggest with the Z-Vive before trying to use the Y-tip?
Oh, I think that Nicole has to watch the previous webinar that we have talked a lot about feeding and how we start with no massage. We start first with massage on the face and then add the vibration. Yeah, because yes, no vibration when it's oral descent, or we have oral defensiveness on the face.
Yeah. What strategies do you have for the lateral lisp, slushy, and the S sound, if I'm saying that correctly?
Yeah, I think, lateral S, it's a big thing in speech therapy. Lateral S is what we say. So you see the tongue is very flat. For sure, we have tongue thrust. So for me, it's very important to work on those exercises that you have to retract the tongue on the base of the mouth. So backing of the tongue and elevation, because for a good we need the tongue to be backward and very strong on the tip. So combination of the bowl exercise, what I show you last, and good position of the tongue on the palate alveoli. Those two exercises are very important to succeed a good S and reduce the lateral one.
Strategies do you have for patients who are congested or who are primary mouth breathers while targeting the bilabials?
Yeah, that's very nice. So everything that we can do to ensure lip closure. I mean, the Y tip, the pattern tip, but if they are mouth breather, there are also other things that we have to check, how well they can breathe through the nose, and re-educate their breathing. So it's not only muscular, they have to work on their breathing too. But the button tips are, I think it's very, very useful in order to work on lip closure.
So it looks like we are about the mark where we kind of want to wrap things up. Is there anything that you wanted to add before we go?
No, it's okay. Thank you very, very much. I hope it was useful. And of course, we have so many more things to say, but the time is short.
Definitely. Well, thank you so much, Angeliki, and thank you everyone that joined in. We're always looking forward to hosting these webinars with everyone. So we hope you guys learned something new today, and we'll see everyone next time. All right, bye.
Bye, everyone.